Hi, my name is Tony Martinez, and I'm going to start sharing here. I'm going to be sharing a presentation on conducting a therapy session. So I'm going to go ahead and share this with you here. So I'm going to get this set up. Okay, so starting with conducting a therapy session. So there are a couple different steps for conducting a therapy session, and I will discuss this in the presentation. A couple of these steps include identifying the need for therapy, preparing for therapy, conducting the therapy, and also following up. And so, first, we need to identify the need for therapy. That's going to be the first phase of starting a therapy session, and that's deciding whether therapeutic assistance is required for a person. So, this often begins when people recognize distress signs such as anxiety disorders, depressed moods, and traumatic experiences. So, a wide range of clients commence help seeking behaviors through personal decision making processes. And while others enter therapeutic support system through referrals from family members or healthcare practitioners. So, we really want to make sure that we're looking at any current issues that the client may have, looking at what goals are they looking for, also about their personal history. So once we've identified that there is a need for therapy, we do want to prepare for therapy, and that is going to be the next step. So when we're preparing for therapy, that means that the need for therapy has been identified. Preparation is critical to ensure a productive therapeutic experience. So, preparation is providing a safe and welcoming environment that promotes open conversation and trust between clients and therapists. So, this involves setting physical space and making it comfortable to only having a few distractions, if none at all, documents such as any evaluation tools or treatment plans tailored to each particular client's needs as it is case by case basis. So before beginning any therapeutic work with clients, therapists should understand applicable ethical norms as well. Also, as well as any legal considerations regarding confidentiality, and these measures are critical in creating an environment in which clients feel safe enough to express their thoughts and emotions without the fear of being judged. We want to establish that relationship. We want to have that trust, and we also want to establish those boundaries. We want to make sure that these clients are feeling heard, seen, and they are knowing that they're not going to be judged. So, moving along here, we can also add in here treatment planning. The process of developing a treatment plan, it really comes from continuous cooperative engagement between a counselor and client without interruption. The creation of well-defined therapeutic goals allows clients to become personally invested in their treatment plan. So we want to make sure that our clients do feel invested, that they are feeling like they are part of the treatment planning when it comes to preparing for the therapy. So we do want to talk about any specific goals. We kind of want to determine a timeline and frequency. How often are they going to come? Um, is there a timeline where we can meet these goals? What about the intervention selection? What type of tools are we going to use to for intervention? So once we have that treatment planning done, we can conduct therapy. So now we've identified the need for therapy, we've prepared for therapy, and now we're going to conduct therapy. So the next step is to conduct the therapy session itself. And during this phase, therapists must use a variety of therapeutic techniques based on any theoretical framework that are tailored to each client's specific needs. Um, so that includes effective communication skills, and these are really essential at this level. We want to make sure that we're using active listening as this enables therapists to comprehend their clients' needs and experiences while delivering that compassionate responses. And, you want to make sure you're validating feelings. So You want to boost motivation with your clients throughout this treatment and let people realize their roles in defining objectives during therapy sessions. They're more inclined to participate meaningful in the process when you do this. So while we're also conducting the therapy, you want to use those verbal and nonverbal cues. You want to let your client explore thoughts and feelings, and then we're also going to work with coping strategies for your client. So we've gone through the process of conducting the therapy, so now we want to follow up. And when I say follow up, that is going to be the final stage of the initial session of for, therapy phases. So following up serves several different purposes. This includes reinforcing learning from prior sessions and measuring progress towards started goals that were stated over time. So some therapists may plan monthly check-ins or booster sessions based on each client's requirements after therapy completion. So this kind of helps to retain accountability and promotes continuous improvement beyond normal treatment times. And so, in addition to that, feedback from clients on therapy experience can provide useful insight into areas for improvement in future practice when increasing the overall efficiency of professional interventions. So, we're looking to check on that progress with our client. Did they make any progress towards their goals? Was there any new challenges? What now needs to be addressed? We need to make sure that we are following up. And so here was my presentation. So I want to thank you for taking the time to listen as we went over um, these slides for conducting a therapy session. Thank you.